Hey everyone, welcome back to my channel. Today we are diving into the world of vitamin B12 deficiency, especially the weird and atypical symptoms it can cause. We will also explore why these symptoms happen in the first place. But before we jump in, let's revisit why vitamin B12 deficiency occurs and what is vitamin B12. Vitamin B12, also known as cobalamin, is an essential vitamin we can only get from our diet. It's found in animal products like meat, poultry, fish, eggs, and dairy. Deficiency can arise from two main culprits. First is poor dietary intake or compromised absorption. Vegetarians and vegans who don't consume enough B12 rich food are at risk. In some cases, even with sufficient intake, absorption problem can occur. Pernicious anemia, an autoimmune condition that attacks stomach cells vital for B12 production, is a classic example of this. Vitamin B12 plays a crucial role in two key enzymes in our body. When B12 deficient, one of these enzymes, methylmalonyl coenzyme A mutase, malfunctions. This leads to build-up of toxic substances called methylmalonic acid. Methylmalonic acid wreaks havoc on our neurons, causing damage called axonal neuropathy. This damage particularly affects the dorsal column medial lemniscus system or DCML in the central nervous system. Due to the impact of that DCML, vitamin B12 deficiency can manifest with some peculiar psychological symptoms. Here are some of the psychological symptoms to watch out for. First is depression. This isn't a typical major depressive disorder. It's a low mood specifically caused by vitamin B12 deficiency. Second is irritability. Low mood often comes hand in hand with irritability in vitamin B12 deficiency. Third is decreased cognition. This can involve memory problems, difficulty in understanding things, and impaired judgment. In older adults, it can mimic dementia. Fortunately, a B12 deficiency can sometimes be the culprit behind these issues. The treatment can lead to improvement. As vitamin B12 deficiency progresses, chronic methylmalonic acid build-up leads to irreversible nerve damage if left untreated. Here's a breakdown of some of the strange neurological symptoms. First is symmetric paresthesis. This means numbness, tingling, and burning sensation, typically felt equally on both legs. Second is shuffling gait. This resembles Parkinson's disease symptoms, with patients taking small steps while hunched over and dragging their feet. Third is reduced point discrimination. The ability to distinguish between two separate touches gets progressively worse. Imagine a doctor lightly touching you with two pins closely. In vitamin B12 deficiency, you might feel only one touch instead of the two. Reduced proprioception. This is the sense of the body's position in space, crucial for balance. B12 deficiency can lead to balance problem, further contributing to the shuffling gait. Next is this hyporeflexia. This means weakened or absent reflexes whenever the doctor taps in specific areas of the body with a hammer. Poor cognitive development in children. Long-term vitamin B12 deficient children can hinder brain growth, leading to developmental delays, lethargy, and failure to thrive. The B12 deficiency partly does not stop at nervous system. It can also affect your mouth. Glossitis. This is an inflammation of the tongue, often appearing red and bumpy. Over time, the tongue becomes smooth due to loss of the papillae, the tiny bumps over it. This is called atrophic glossitis. Burning and itching sensations are common complaints. Next is angular cheilitis. This is an inflammation of lips, particularly at the corners, which can crack and become painful. Vitamin B12 deficiency for healthy red blood cell production is very essential. Here's how a deficiency can cause weird blood-related issues. First is macrocytic anemia. This type of anemia involves abnormally large red blood cells. It's different from iron deficiency anemia, which causes smaller red blood cells. Next is the symptoms of anemia. Here we see fatigue, shortness of breath, exercise intolerance, weakness, and irregular heartbeats are all the signs to look out for. That's a whirlwind tour of some truly weird symptoms caused by vitamin B12 deficiency. Remember, this isn't medical advice, and if you suspect deficiency, please consult your healthcare professional. They can perform tests and recommend the best course of treatment, which often involves vitamin B12 supplements. Thanks for joining me today. If you enjoyed this video, smash that like button and subscribe for more informative content. Until next time, stay healthy.